Your body has a way of signaling when something is seriously wrong. Recognizing these signs in time can mean the difference between life and tragedy. Today, we'll discuss 7 physical symptoms that should never be ignored. These are warning signals that medical professionals say require urgent hospital care. No delays, no second guessing. This isn't about causing fear. It's about keeping you safe. Many older adults hesitate to seek help because they assume their symptoms are minor or they don't want to trouble anyone. But acting quickly can prevent a small issue from turning into a life-threatening crisis. More importantly, knowing what to watch for gives you control over your health. In this discussion, you'll learn about 7 critical warning signs that should never be overlooked. These aren't vague or confusing symptoms. They are clear, specific, and in many cases require immediate attention. Stay with us until the end because knowing these signs could save your life or the life of someone you love. Sign 1. Slurred speech or facial drooping. There are certain symptoms that medical professionals recognize instantly because they point to a serious emergency: stroke. If you suddenly struggle to speak, notice your words are slurred or garbled, or find that one side of your face isn't moving properly, seek medical help immediately. Another key sign is the inability to lift one arm, or if it drifts downward when you try. These symptoms are not to be ignored. They indicate that your brain may be in serious distress. A neurologist once stated that for every minute a stroke goes untreated, nearly 2 million brain cells are lost. Time in these situations isn't just valuable, it's everything. It affects memory, speech, movement, and ultimately, survival. For older adults, strokes can happen unexpectedly. You might be reading, watching TV, or eating lunch when suddenly your words don't sound right, or your smile becomes uneven. These subtle changes might not feel alarming, which makes them even more dangerous. The sooner you get treatment, the better your chances of recovery. Take Robert, a 68-year-old Vietnam veteran. One morning, while having coffee, he suddenly dropped his cup from his right hand and couldn't understand why. When he called for his wife, his speech was unclear. She immediately noticed his smile was uneven and called emergency services. Robert received medical attention within an hour and recovered fully. "If she hadn't acted fast, I might be in a wheelchair or worse," he later admitted. Doctors use the acronym FAST, Face, Arms, Speech, Time, to help people recognize a stroke. The most critical letter is T for time. If you notice slurred speech, an uneven smile, or weakness in the arms, don't delay. Don't wait to see if it improves. Don't schedule a doctor's appointment. Call for help immediately. When it comes to a stroke, fast action can mean the difference between recovery and permanent disability. Sign 2. Sudden chest tightness or pain. One of the most serious warnings your body can give is sudden, unexplained pain or tightness in the chest. This sensation may feel like pressure, squeezing, or even burning. It can spread to your arms, shoulders, neck, or jaw. Many people mistake it for heartburn or anxiety, but it could be a sign of a heart attack. For older adults, heart attack symptoms can be different from what is commonly portrayed. Instead of intense chest pain, you may feel a dull ache, an unusual fluttering sensation, or simply a feeling that something is wrong. You might also experience dizziness, shortness of breath, or sudden fatigue without exertion. These are signs that require immediate medical attention. A cardiologist once shared that many patients arrive too late because they assume their symptoms were mild indigestion. This delay can be fatal. If there's even a small chance your symptoms are heart-related, get checked right away. Consider Helen, a 74-year-old retired teacher. One afternoon, while reading a book, she felt a strange tightness in her chest. It wasn't severe, but it didn't go away. "I thought it was just gas," she later said, "but something told me to call my daughter. Her daughter rushed over and insisted they go to the hospital." It turned out Helen had suffered a mild heart attack. Thankfully, because she sought treatment quickly, she made a full recovery. "If I had waited, I might not be here," she said. This is the key lesson. When your body is in distress, it doesn't always scream. Sometimes it whispers. And with heart-related issues, those whispers can be the final warning. Don't wait until you collapse or struggle to breathe. If you experience chest discomfort that is unfamiliar, persistent, or accompanied by other symptoms, seek medical attention immediately. Sign 3. Shortness of breath without exertion. There is a difference between catching your breath after climbing stairs and struggling to breathe while sitting still. If you find yourself gasping for air while doing nothing strenuous, this is a serious warning sign. Sudden shortness of breath without physical activity can indicate conditions like heart failure, pneumonia, or a pulmonary embolism, a blood clot in the lungs. These issues require urgent medical attention. A respiratory specialist once said, "If breathing becomes difficult for no clear reason, that's your body raising an alarm. It's not just aging or fatigue, it's a sign that something is wrong." As we age, our lungs naturally lose some capacity, and our heart works harder to supply oxygen to the body. But when breathlessness appears suddenly and severely, it's not normal aging, it's a potential emergency. If you struggle to breathe after simply walking across a room or wake up feeling like you can't catch your breath, don't ignore it. Take Walter, a 76-year-old retired electrician. He had always been in decent health, but one evening, while watching TV, he suddenly felt like he couldn't get enough air. There was no chest pain, fever, or reason for it, just overwhelming breathlessness. His daughter convinced him to go to the hospital, where doctors discovered a small blood clot in his lung. "If I had waited until morning," Walter later said, "I might not have woken up." This is the takeaway. Shortness of breath isn't something to wait and monitor. It's something to act on immediately. If breathing becomes difficult for no clear reason, go straight to the hospital. It's better to be told it was nothing than to realize too late that it was everything. Sign 4. Sudden confusion or disorientation. If an older person suddenly becomes confused, forgets familiar details, or seems lost in a known place, it's easy to assume it's just old age. However, sudden mental fog, especially if it happens abruptly, is a serious warning sign. It could be caused by a stroke, brain infection, dangerously low oxygen levels, or a severe reaction to medication. Every one of these requires immediate medical attention. A hospital specialist once said, "In older adults, the brain is often the first organ to signal trouble." Sudden confusion is the body's emergency light flashing. Unfortunately, many families overlook this symptom, assuming the person is just tired or having an off day. But when memory issues appear out of nowhere, like forgetting names, getting lost, or speaking incoherently, it's a medical emergency. Take Linda, an 80-year-old woman who lived alone. One morning, her neighbor found her standing in the hallway, confused about how she got there. She was fully dressed, but seemed startled and kept repeating the same question. Her family thought she might be dehydrated or exhausted. But at the hospital, doctors discovered she had a urinary tract infection that had triggered sudden delirium. With antibiotics and fluids, she recovered in a few days. "I never knew confusion could come from something like that," her daughter admitted. Now I'll never ignore it. The brain is sensitive, and in seniors, it often responds to infections, lack of oxygen, or blood sugar changes before any other symptoms appear. If confusion comes out of nowhere, don't wait. Seek medical help immediately. It could save a life. Sign 5. Severe or sudden abdominal pain. We all experience aches and pains, especially as we age. But when the pain is sharp, sudden, or intensifies by the minute, particularly in the abdominal area, it's not something to ignore. Severe abdominal pain can indicate a medical emergency such as appendicitis, a perforated ulcer, pancreatitis, or even internal bleeding. In older adults, it could also signal a blocked intestine or a ruptured organ, both of which can be life-threatening if not treated immediately. A trauma surgeon once said, "When a senior complains of sudden abdominal pain, we take it very seriously because time makes all the difference between a fixable problem and a fatal one." This perspective is critical because for seniors, the risk of complications is higher and symptoms don't always appear in the usual way. You may not have a fever or visible swelling, just a vague feeling of being unwell or, in some cases, a sudden debilitating pain. Let me tell you about Frank, a 72-year-old widower who prided himself on being tough. One evening, while finishing dinner, he felt a sharp pain in his lower abdomen. Assuming it was just gas, he took some antacids and went to bed. By morning, the pain had spread and he was too weak to stand. His daughter called an ambulance, and at the hospital, doctors discovered a twisted section of his intestine that had cut off blood flow. Emergency surgery saved his life. Frank later admitted, "I thought it would pass. I didn't realize how fast things can go downhill. This is a common mistake. Many seniors downplay their pain, hoping it will improve. But if your pain is sharp, persistent, or unlike anything you've experienced before, don't wait. Get it checked out. Acting fast could save your life. If you experience intense abdominal discomfort that doesn't go away, especially if it's accompanied by nausea, vomiting, or dizziness, don't guess and don't Google. Seek medical attention immediately. Sign 6. Persistent vomiting or vomiting blood occasionally throwing up due to food poisoning or a mild stomach virus is unpleasant, but usually not serious. However, if vomiting persists for hours or contains blood, it's a major red flag. Persistent vomiting can lead to severe dehydration, electrolyte imbalances, and even kidney problems. Vomiting blood, whether bright red or dark and grainy like coffee grounds, could indicate internal bleeding, a torn esophagus, or ruptured ulcers. A gastrointestinal specialist once stated, "Blood in vomit is never normal. It's one of the fastest ways we identify internal bleeding in older adults." Let's look at Evelyn's story. She was a 79-year-old woman who had been taking over-the-counter pain relievers for her arthritis. One night after dinner, she started vomiting and assumed the shrimp she ate was to blame. But when she saw dark flecks in the sink, which she thought was old food, her grandson insisted on calling for help. At the hospital, doctors diagnosed her with a bleeding ulcer that had been silently developing for months. Evelyn later admitted, "I had no idea it was that serious. If I hadn't gone in, I might not have lasted another day." That's why vomiting blood should never be ignored. It's not something to sleep off or fix with ginger ale. It means something is seriously wrong, and only immediate medical care can determine the source and stop it before it's too late. If you find this information valuable, comment #6 below to let us know you're here. And if you haven't already, subscribe and turn on the notification bell so you never miss our important health updates. Sign 7. High fever with stiff neck and sensitivity to light of fever is usually a sign that your body is fighting an infection. But if that fever is high and accompanied by a stiff neck, headaches, confusion, or trouble tolerating bright light, it may be a symptom of meningitis, a life-threatening inflammation of the protective layers around the brain and spinal cord. While meningitis is more common in younger people, it can absolutely affect older adults, especially those with weakened immune systems or chronic health issues. And when it does, it progresses rapidly, too fast to ignore. An emergency physician once said, "If an older adult comes in with a fever and can't bend their neck or tolerate light, we drop everything." That's how urgent it is. By the time these symptoms appear, the infection may already be in full swing. The stiffness in your neck isn't just discomfort. It's a sign that the protective lining around your brain is inflamed. The light sensitivity isn't just annoying. It's a sign that your central nervous system is under attack. Some may also experience nausea, vomiting, or intense pressure in the head. Consider Jerry, a 75-year-old widower and avid crossword puzzler. One morning, he struggled to finish his daily puzzle due to a pounding headache. By the afternoon, his neck was so stiff he couldn't look down, and the sunlight streaming through his kitchen window felt unbearable. Fortunately, his neighbor, a retired nurse, recognized the signs and rushed him to the hospital. Doctors confirmed bacterial meningitis, and thanks to fast intervention, Jerry survived. "I thought I was just run down," he later said. "I had no idea it could be something so serious." When your body sends warning signs like fever, stiff neck, and light sensitivity, don't ignore them. Meningitis moves quickly, and every hour counts. Treatment is effective, but only when started early. If you or a loved one experiences these symptoms, don't wait for an appointment or try to sleep it off. Go to the emergency room immediately. Final thoughts by now. You've seen how important it is to listen to your body, especially as you get older. These 7 warning signs aren't meant to scare you, but to empower you. Knowing when to take action isn't a sign of weakness, it's a sign of wisdom. And wisdom, especially the kind that comes with years of experience, means understanding that your health deserves urgency, not delay. It's easy to brush things off and say, "I'll be fine," or "It's probably nothing." But in the stories we've shared today, people survived only because they acted, because they or someone around them recognized the danger, picked up the phone, or went to the hospital. Taking care of yourself isn't just for you, it's for your family, your friends, and the people who love and need you. Every day you stay safe and strong is another day they get to enjoy your wisdom, your stories, and your presence. Your health is a gift. Treat it like one. Thank you for watching. We'd love to hear from you. Leave a comment below and share something you learned today or how you plan to use this knowledge in your life. Your thoughts matter to us, and reading your comments gives us motivation and encouragement. If you found this video helpful, please like, subscribe, and share. Awatamai. Your support allows us to continue creating valuable content to inform and inspire you. Stay safe, and we'll see you in the next video.